Hi everyone, my name is Swati Maan and I'm a dentist. Today's topic, which I'm going to discuss with you, is the sensitivity in the teeth. Well, the sensitivity is a very weird and it's an electric shock sensation that you get when you have something really very cold or sometimes too hot as well. Well, I'm going to tell you here there are lots of reasons for the sensitivity, and sometimes that's our lifestyle, which is leading to all the pain that we're going through. So if your sensitivity is only confined to one part of your mouth, and let's say you see that it's coming from one region of my mouth, and most likely you're going to have a cavity and your dentist will check that out for you. Number two could be the tooth surface loss, which means the outer shell of your enamel or the outer layer of your tooth, which is enamel, is getting weaker and unhealthy, and your tooth is giving you a response in the form of sensitivity. The most common cause of having a weak enamel is the diet, which means having a lot of citrus fruits, which are very healthy for the body, but we've got to tweak that a little bit. Having a lot of fresh fruit juices, orange juices, white wine, or fizzy drinks. So if you're fond of all these drinks, it's very important to use a straw or eat something with that. Or make sure that if you're having a citrus fruit or a drink, you do not brush your teeth right after. Leave at least a half an hour gap between having this and brushing your teeth. Number two reason is the aggressive brushing. Sometimes we are very, very aggressive or very vigorous with our brushing, or we are brushing our teeth for too long. Of course, the intentions are right here, and we want to get rid of all the plaque and tartar. Your enamel can sustain a certain amount of pressure, but your gums cannot. So if you're brushing too hard, you're putting a lot of pressure, and your gums are undergoing a lot of pressure change, which can lead to the gum recession and, of course, the sensitivity to your teeth. Acid reflux, which means having an acid regurgitation or having some acidity, which creates a bad taste in the mouth and also ruins the outer shell of your enamel and, of course, leading to sensitivity. Sometimes the teeth whitening is also associated with the sensitivity, but that's generally not something to worry unless you have bought a product without your dentist recommendation or you have bought something over the counter. So usually the sensitivity which is associated with the teeth whitening goes away on its own. But if it's not going away or if it's getting worse, it's always good to speak to your dentist. Sometimes the sensitivity is also related to the grinding or clenching. Well, the grinding and clenching nowadays is very common because we subconsciously grind or clench our teeth. That means we are ruining the outer shell of our enamel, of course, leading to the sensitivity again. Mostly the causes of the sensitivity, if we find out, is nothing to worry about, but it's always important to know what is the real cause of having this sensation in the mouth. So the best thing to do is to go and speak to your dentist in detail, discuss all these things with him and tell him or her that, you know what, this is what's happening and what could be the cause of that. But to relieve the symptoms until you go and visit your dentist, you can buy some products over the counter as well. Sensodyne has a wide range of toothpaste which you can use to relieve the sensitivity. If your sensitivity is very transient and it comes and goes, you can use Sensodyne Rapid Relief, which you can use in the form of a toothpaste morning and evening. You can also use Sensodyne Repair and Protect. So if your sensitivity is from the deeper tissues of the tooth, you can always use the Repair and Protect as your toothpaste as well. So this was all my explanation about the teeth sensitivity, and it's just generalized the whole thing. So if you have any questions, feel free to drop your questions in the comment and I'll be more than happy to answer. So until then, I will say bye-bye for now and I will see you in my next video. Thank you for watching.